Okay, now you can continue. Okay. I am making you host.
Okay, sir.
Thank you, Anupama, for joining.
Anupama is also
Yes,
there.
sir.
Great.
Thank you.
Okay.
Please follow.
Okay,
You will
then.
learn something new. And Priya is very good speaker.
Thank you, sir.
So I am leaving Priya, okay?
Okay, sir.
So now you can do all those.
Good evening, everyone. How are you all?
Good evening, ma'am.
Fine, fine, madam.
And why did you not attend the last class?
Sorry, madam. Actually, last Sunday I was out of town. I was at Puri from 10 to 12. I have already informed Dr. Rai in previous classes.
Yeah. I'm also going to Somnath, ma'am.
Okay. And don't you think it is your responsibility to inform on the WhatsApp group?
Actually, WhatsApp not working 2 to 3 days, ma'am. I'm calling, but no network is there. Network issue also, ma'am. Then today I'm changing my mobile number.
Next time, if anyone is planning to miss any class, you have to inform prior what is the reason, right? Because every class is
Oh, yes.
prepared beforehand and it is not appreciated if you leave
Sorry.
without informing at all.
Yes, ma'am, we can understand that, and I have already prior information was there for from me to Dr. Dottorai. In last class, I have said that I will be not able to join from 10 to 12, and network issue was also there in Puri area due to Snan Jatra of today for the last 3 or 4 days. There the jammer was there, so there is no network. And I was unable to send message in WhatsApp group. Sorry for that.
Okay, please from next time, please do inform. Abhishek, you too. Okay, so today we would be, in the last class, we discussed anxiety disorder, difference between fear, phobias, and panic attacks, their diagnostic criteria, what is difference between anxiety and when it is called anxiety disorder, what are some of the treatment plans, what are some of the therapies which are used, how to identify anxiety in children. And on the same note, we would be talking about depression today. And the next topic I would also be taking in the next hour is some of the screening tools. So you would have been using and applying some of the screening tools while your practice, and even if you haven't applied any of the screening tools, you must have heard of some of the screening tools which are used to identify the severity of symptoms of anxiety, depression, stress, attachment styles, state trait anxiety. So we would be discussing some of the screening tools so that whenever you are practicing, you can identify the severity of the symptoms, and on the basis of that, you can plan your intervention strategies. So I would be showing you a video, and you have to identify what are some of the symptoms which you identify in the video. I'm sharing the screen, and it is a small video regarding depression. So on the basis of that, please identify. What do you know about depression? And please do join the Google Classroom. Okay, I'm sharing the video, and please do make a note or try to remember some of the symptoms which you can identify in the video.
Madam, can I share something?
Yes, yes.
Because you asked
Wait.
questions. Okay.
I'm making the screen.
Are you someone who gets unwanted thoughts
Sorry.
about cleanliness?
सारा पैसा including
It is.
TV experts, YouTube influencers.
Yeah.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, Research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
Okay, now you can speak, Abhishek. Anyone? What all symptoms did you identify? What stood out for you? What did you learn new just from this video? Or do you have any questions to begin with?
Yeah. Yeah. Thank you, ma'am. Good evening, everyone.
Good evening.
Ma'am, depression एक्चुअली एक चिंता होती है, वो 1 या 2 दिन या 15 दिन या 1 वीक या 1 मंथ तक होती है, लेकिन जब वो कंटिन्यू अगर हो रही है 1 मंथ या 2 मंथ या 6 मंथ, तो वो डिप्रेशन में कन्वर्ट हो जाती है मैम। और दूसरा, इसके सिम्टम्स में बहुत सी बार किसी को पसीना आता है, किसी का प्रेशर बढ़ जाता है, ब्लड प्रेशर बढ़ता है, किसी का लो या हाई हो जाता है, सांस में प्रॉब्लम फील होती है उसको, धड़कन बढ़ जाती है किसी की। ये सिम्टम्स हैं। इसके अलावा उसके काम करने की जो इसमें भी बताया था वीडियो में, वो स्लो हो जाती है, या उसको इंटरेस्ट कम आता है, या फिर जनरली अगर व्यक्ति डिप्रेशन में है तो वो लाइट मतलब अंधेरे में ज्यादा रहना पसंद करता है, और वीकनेस होता है, थोड़ा नेगेटिविटी की ओर जनरली देखा जाता है। थैंक यू मैम।
Anyone else wants to add to what Abhishek just said?
Madam, may I?
Please go ahead.
Yeah, actually, I just want to share one of my known person. Actually, she is in my relatives' aunt, Kaki, Amar Kaki. She has a typical exceptional symptoms in depression. It shows some elevation of his work, and she is to some extent violent in depressed condition. And actually, the thing is that her depression symptom is totally exceptional, as psychiatrist said that she overnight she walk when she is in a depressed condition. His walking condition remains 22 hours.
Oh,
Within 24 hours. She don't like to sleep at all. Any household work or anything he want to do, doing repeatedly when she is in a depressed condition. It is an exceptional symptoms I have seen in my own eyes, and that's why I want to share.
Is she diagnosed for depression?
Yeah. She is diagnosed for depression. She is having medications for last 12 years, and the condition is that she's okay, but in a year the symptom it is nearly 6 months to 8 months interval. It comes and persists for 1 week or 2 weeks. After that, it is okay. And in that period, when the symptoms come, initially she is more talkative, and she want to walk more, and insist others to walk more. And then the family persons understand that now it has been started again, and it will persist for 1 or 2 weeks, and then.
Okay, interesting. This is an interesting case. Okay, thank you so much.
Ma'am, I want to say something for a special case.
बिल्कुल.
Also. एक लेडी है, वो इतनी खुश रहती थी, ओवर मीन्स मैं नाम तो नहीं बताता हूँ, तो वो जो ओवर खुश होता है, एक लिमिट होती है, उससे ज्यादा खुश रहना, जो मतलब उनका एक्साइटमेंट की लिमिट नहीं होती है। इसके अलावा फिर क्या, वो इतना खुश होने के बावजूद भी ना रात भर उनको नींद नहीं आ रही, वो घूम रहे हैं, वो भी एक डिप्रेशन जो हमने देखा है साथ में। नींद नहीं आना तो हमको समझ में आता, लेकिन इतना खुश रहने के बावजूद भी व्यक्ति है ना वो डिप्रेशन का शिकार था। जनरली हमने ये पढ़ा था कि थोड़ा मूड ऐसा लो होता है या चेंज होता है, लेकिन वो हमेशा खुश ही है, और नाइट में पता लगता है कि ना वो केवल उसका मूड चेंज हो रहा है। फिर कभी कभी सिगरेट भी मतलब 3-4 बजे पी रहे हैं, नींद नहीं आ रही। तो ये सब केस हमने मतलब स्टडी किए थे इनके। तो मतलब वो एल्कोहलिक हो जाता है धीरे धीरे इस person। और मतलब मीन्स उसका मूड बिल्कुल हैप्पी है, कोई आप देखोगे तो उसको दिन भर देखेंगे तो कोई चिंता नहीं, और एनर्जेटिक है वो भी 15 डेज तक एनर्जेटिक है। उसके बाद वो बिल्कुल 15 डेज के बाद चेंज होता है उसमें, बॉडी बिल्कुल उसको नींद आना लग रहा है, मतलब स्लो हो गई है उसकी बॉडी, और बहुत नींद आ रही है, वो फिर वो 10 दिन तक सोते रहते हैं। ये मैंने केस देखा था मैडम।
Depression, just the way you saw in that video as well, that depression can slow you down. It is a possibility that depression can slow you down to the extent that even basic tasks such as getting up, brushing your teeth, or having water becomes difficult. So it is one of the way depression shows in your body and in your behavior. Okay, so the video was also talking about how being sad and being depressed is different. Anyone wants to comment on that?
Ma'am, please repeat. I can't hear you properly.
Okay, so in the video, in the beginning, the person said that being sad and being depressed are two different things.
Yes, ma'am. Being sad, it happens the duration or the suffering is very short period time, or very superficial. But the depression, having depression, it is long term and it is very deeper. In as we say, he's suffering from 15 days to 1 month and 6 months. And yes, ma'am. And one thing I want to add, ma'am, that my previous my friends said some different symptoms of depression. As we taught in our medical school, depression is a lack of expression. तो माने जहाँ पे उनका मन में इतना इमोशन चल रहा है, कुछ ना कुछ इमोशन चल रहा है, चाहे पॉजिटिव या नेगेटिव हो, अगर उन लेवल का जो इमोशन अंदर चल रहा है अगर बाहर एक्सप्रेस नहीं कर पाता है, हम लोगों को मेडिकल स्कूल में सिखाया गया वो ही डिप्रेशन बन जाता है, लैक ऑफ एक्सप्रेशन। क्योंकि ये जो ज्यादा कम करने, जो अर्पिता मैम ने मेरी जो फ्रेंड जैसे बताई है, तो वो ज्यादा कम करना माने उनका मन में ऐसा कुछ सिचुएशन चल रहा है लेकिन उसका एक्सप्रेशन जो है उन बराबर नहीं हो रहा है, तो इस कारण उनका डिप्रेशन चल रहा है, माने बहुत पैरेलल नहीं जा रहा है, फीलिंग एंड एक्सप्रेशन। यस मैम, थैंक यू मैम।
So right, this is very true. Sometimes people who are depressed do not look depressed, because depression, any psychological condition, it is not very easy to see in forms of physical symptoms, because everything is going in the head and in the person's mind, the way that person is processing it. So there was one striking fact in that video, which was that sometimes people deal with depression, suffer with depression for years and they don't even know. And even before they know the difference between identifying if something is wrong and taking some step on it, that I have to take some help, sometimes they might even take even 10 to 12 years, sometimes 10 to 15 years. In that case, the depression, the severity of the depression has increased so much that it is very difficult for the psychiatrist and the psychologist to bring them out of it. And it takes a lot of time and a lot of work, because the depression has settled in the body so much. So yeah. Okay, so I'm sharing the screen now. And let's finish depression first, and then we'll talk about. Can you see my screen?
Yes, ma'am.
This is the maximum I
Yes,
can.
yes, ma'am.
Okay. Okay, so today we are talking about depression. So as we understood that everyone has some point of time has felt depressed, sad or downs, and it is a normal reaction to stressful events, and it can happen because of any loss or life struggle, and after that our mood begins to lift. So our mood as a response to different life situations, struggles and events, it is okay to feel down. And but depression, when we talk about depression, it is okay to feel sadness, but depression is a serious medical condition which affects your behavior, your thinking, your emotions and physical health over time. So while feeling down, feeling sad only lasts for a short while, depression can affect you for at least 2 weeks and affect your everyday life and ability to function. सैडनेस से हमारा मूड थोड़े दिन के लिए खराब हो सकता है for a few weeks, but depression, when it is consistently, we are consistently feeling low and it impacts our everyday life and our ability to function, then there is something to worry about. Then there is something which requires attention of a professional. So depression can also vary from mild to severe, and it can have a profound impact affecting every aspect of the individual, their relationship, family and work life. So there are some of the symptoms of depression: feeling sad or empty, you are feeling void, एकदम खाली खाली लग रहा है, mood बहुत खराब हो रहा है, feeling hopelessness and helplessness, there is no hope and you feel helpless without a reason. You feel there is a feeling of low worth, person feel worthless, feeling excessively guilt. There is a guilt for no reason, that I was not able to do that, I am not able to even wake up, I'm not able to even maintain my the way I am groomed, I'm not able to even keep up with my daily task, how will I work, how will I study. The pleasure in the activities, a person who is going through depression, even if they like dancing, singing, painting, they no longer enjoy the things they used to do. There are bursts and outbursts of anger and irritability. There is fatigue and lack of energy, because depression can be so taxing on our body that a person sometimes oversleeps, and even after having enough sleep, they all constantly feel tired and exhausted. Insomnia and lack of sleep. So one side of the coin, some people have fatigue and lack of energy, and for some people it is very difficult for them to sleep because they are constantly feeling empty and processing the thoughts, ruminating about life events, that it is very difficult for them to at least come to a state of rest. Poor memory, concentration and decision making, they're constantly forgetting their things and they're not able to recall very basic things. Whenever they are trying to concentrate, their mind always wanders away. They're not able to make very basic decisions such as what to eat for dinner and what dress to pick up for this event, and if I should go out or not, if I should complete this task or not. Very basic things become very difficult for them. Lack of appetite. So there are people who lose weight when they are depressed because they don't feel like eating, and sometimes when the depression is so severe, there are people who forget eating and drinking, and they are falling down, they are having a low appetite and low blood sugar. Darsh is asking what to do when we know that the person is depressed for years, but he's considering it as normal life situation. How could I convince him to go to a counselor? Okay, Darsh, let me complete the symptoms and I'll answer your questions. Okay, so by when you are you are feeling this for a very long time, you are overeating. There are people whenever they feel sad, they want to feel good by eating a lot, and due to that they gain weight. There are there are certain ways in which depression manifests in your behavior. So बहुत सारी चीजें हमारे behavior में नजर आती है, बहुत सारी चीजें sometimes when people are not expressing themselves, they are keeping it to themselves, it appears it manifests in their body. So sometimes it manifests in the ways of body ache and body pain. सर दर्द है जो ठीक ही नहीं हो रहा है, पेट दर्द है जो ठीक ही नहीं हो रहा है, your body weight is increasing or it is decreasing, and sometimes you have a person can think about death and suicide and contemplate about dying, because everything is so overwhelming that it is very difficult for them to even manage that. So they're not actually looking for death as an option. They are just trying to run away from the how chaotic the life and how difficult the life feels like. So when all these symptoms or a series of symptoms are being experienced by a person for a very long time, then it is depression. Okay, so I want to answer Darsh's question that, wait. What to do when we know that the person is depressed for years, but he is considering it as normal life situation? How could I convince him to go to a counselor? Okay, so there is one thing that, when a person has been feeling low for years and they think it is okay, this is how I am, try to give them reference when they used to feel good. Suppose if a person who was talkative and jolly and was interested in social situations and was a different personality altogether, and if you identify that there is marked difference in the way that person behaves, feels, and there is all these symptoms you can see, if not on some level, but you can see a general sense of fulfillment in the life. If a person is constantly talking about all the negative stuff very discreetly, there are people you wouldn't even know that they are experiencing depression, they have depression. All the time they would be sharing very sad songs, very sad memes, very sad posts, and they would be liking the sad shairis, sad songs and sad poems, sad stories, and all these things. But when you're talking to them, it wouldn't feel like that there is something wrong with them, because there is so much taboo around depression that it is very difficult for them to come out and say that, yes, I'm struggling in my life. And sometimes, so when you are talking about a person who has been experiencing depression and now they have regarded this, that it is it is okay, it is normal, you have to give them reference when they used to feel good. Suppose they used to enjoy meeting people, talking to people, and maybe they used to do certain hobbies, they are not even talking about it. So yes, then you have to give them references of when they were able to do those things, they are not doing it now. So yes, the person is not even talking and being negative at all circumstances. So it is depression, it is clearly depression, but the person is not even. So you have to tell them the references कि कब आपको अच्छा लगता था. There was once upon a time when I have seen you a lively person, a person who was living every day, was enjoying everything. Yes, there were sad moments, there were sad events, but you were not a sad person you were not a sad personality. So by giving them references, they would be able to identify, yes, there is some stark difference in the way I have been, and it is not normal anymore. It is not normal to feel sad like this. So by giving them some references, and not just you, their family members can also give references that earlier we used to go out, now you don't even feel like going out. Earlier your friends used to come over and we used to have evening parties, or you used to go out and you used to meet your friends. So we are not holding those parties and those arrangements anymore. So there is some part of your personality which is not getting expressed. So this is how you can help a person identify that, yes, there is a very stark difference in the way they have been behaving. So, okay, this is it. Okay, so in the video also, when we were talking about the causes of depression, there can be so many causes. There is no one trigger to depression. So a buildup of stress and anxiety from being bullied, working too hard, or family situation. So as Abhishek was saying, there are some people who experience depression because for years the stress they have been feeling, the anxiety they have been feeling, it has been piled up for over the years, and no intervention has been done. They did not seek any help, and the environment was not supportive that they could come out and talk to anyone. So when there is a build-up of stressful events one after other, then it can take up a form of depression after a few years. Sometimes alcohol and drug abuse can also cause depression. Grief and serious life changes, such as when someone dies, you become seriously sick, there is a life-threatening condition, lose your job, have an accident. So having an accident can make you dependent on people. And on the other hand, you were a very independent person, you did not like anyone to help you with things, but after having experiencing an accident, you are suddenly dependent for moving. So that it can make you feel like worthless, your self-esteem can take a toll. So yes, these are some of the causes. There are also some genetic conditions which can contribute in experiencing depression. So yes, it also runs in families, and you might inherit the genes that make it more likely for you to have depression. So, but iska matlab ye nahi hai that if a family member suffering from depression does not mean that you will as well. But the entire idea about is that when you have a tendency, so it is a mix of both the natural fact, your internal neurochemistry and also the environmental factors. I want to tell you the very important aspect of how psychological disorders can show up in your body or in your total thing. So there are something called environmental factors. Okay, and these are some your genetic factors, which you can also include your neurochemistry, your entire inheritance wala part. So it is a function of your environment and genetic factors. Suppose you have genetic factors that somebody in your family or आपके परदादा दादा बहुत पुराने, they have experienced depression, and at that point of time nobody knew what depression is, forget about getting it diagnosed. But you can recall that maybe a great grandfather might have been feeling depressed, and was feeling low and was feeling out of place, out of their behavior for a very long time, was into himself. So there could be some genetic factors, but zaruri hai kya? Is it mandatory that you would also get depression? Is it mandatory if you have genetic predispositions
No, ma'am.
you also
No,
get
ma'am.
depression?
No, ma'am. It depends
No,
on personality, how they can cope up with their depressed condition, their mental upbringing. Various kinds of things depends, ma'am.
So this also happens with depression, that you might be having the genetic predisposition of depression, but you might not experience it because there was no event which could trigger the depression out of you, or you haven't experienced such very strong event to evoke this genetic predisposition. But the reverse also happens. Sometimes you have so many environmental factors that you do not get a right environment for your expression of your personality. Your family environment is not good, you're constantly facing several stressors. But even after that, there are some people who do not face depression. So when we talk about depression, it is a mix of both the genetic factors and environmental factors. And so all of you, please help me with some of the environmental factors which can contribute. So environmental factors does not mean the greenery and environment. I hope you understand what are the environmental factors. Can you give some examples?
Ma'am, may I?
Yes, please.
Yeah, I just want to cite one example of my student. Actually, she was my student in graduation level, and her father and mother both was too much busy with their work schedule, and that's why they have very few hours time for Anisha. And the fact was that the environment, a family environment, was not at all suitable for that children. And from beginning, from the beginning, we can understand that when she was admitted in our college for graduation, that she is not okay. And we have informed in parent meeting to her mother that you have to consult with psychiatrist or psychologist, that we are feeling that she is not okay, and she is totally depressed in our classes, and the behavior and the mixing with other students and everything is not normal. But her mother or father is doctor also, but they were not ready to accept it. I think they can understand that their child is not okay, but they are not ready to accept it. And her father said that as I am I'm a doctor, MD doctor, I can understand better, and it need not to say us about the mental health of my children. But end of the day is very, very bad. In a third year, it was part 1, part 2, part 3 system few years ago, and third year she was unable to give the final university exam due to severe mental illness, and the depression, prolonged depression, turned her to a very, very bad mental condition. And he just stopped to eat everything. Prolonged depression, you can understand. He stopped eating everything, sick, hemoglobin level fell down very badly, hospitalized, and unable to appear final exam. And I just want to share this, that it is a very bad environmental effect also.
Yes, indeed. Anyone else wants to add that some of the environmental factors which can cause depression?
Yeah, ma'am.
Yes, please go ahead.
मैं जब एक बच्चे की काउंसलिंग के लिए गया, क्योंकि उसके फादर और मदर दोनों बहुत लड़ते थे। हेलो।
हाँ,
तो
हाँ।
उस उन दोनों की वो लड़ाई देखी, वो बच्चा बहुत डिप्रेशन में बिल्कुल अपने आप को सिकुड़ लिया उसने, मतलब ना फीलिंग शेयर करता था, ना उसके फ्रेंड सर्कल बने, वो मतलब धीरे धीरे डिप्रेशन में चला गया था। और अभी क्या उनका दोनों का केस चल रहा था, उसके फादर आए थे मेरे पास कि इनको आप केयरिंग करो। तो मुझे समझ में आ गया था कि इसका कोई इतना स्पेशल नहीं था बच्चे का, बच्चा नॉर्मल ही था, लेकिन वो इन्वायरमेंट वो देख के प्रॉब्लम होता था। तो अभी क्या उनका केस चल रहा है फादर का, वो बच्चा फादर के पास रहता, तो उनको बताया मैंने कहा आप अपना बिहेवियर थोड़ा चेंज करो बच्चे के प्रति। और बच्चे को भी देखा, थोड़ा उसको स्पोर्ट्स किया, तो उसका वो मतलब थोड़ा टाइम मतलब उसको शेयर करो, थोड़ा गार्डन ले जाओ, थोड़ा सा घुमाओ। तो उस तरह से बच्चा थोड़ा फेमिलियर हुआ, थोड़ा मतलब खुलने लगा है वो। तो वो इनका फैमिली की इन्वायरमेंट की वजह से मैडम वो बच्चे में चेंजेस आए थे। थैंक यू।
Family environment is one of the thing,
यस मैडम, बहुत वेरी स्पेसिफिक इफेक्ट
because
ऑन लॉन्ग
family
लाइफ।
environment can trigger a lot of things. It can internalize a lot of things, that there is no support, there is no support, I cannot be seen, I cannot feel heard, and it is not good to feel like that I'm not safe in this environment. My parents who were supposed to take care of me are fighting, and now suddenly I have to be uh, I have to be I might be responsible for what they are feeling. So there are so many things which can trigger in. Okay, which can trigger. Okay, anyone else want to add some environmental factors? Think about some more environmental lifestyle
मैम
factors.
एक स्पेशल केस देखा था मैंने स्टूडेंट्स का।
Hmm.
एक हॉस्टल में हम गए थे, तो वो हॉस्टल आदिवासी का था उनका। तो एक बच्चे, जैसे किसी को पता नहीं होता ना कि हम डिप्रेशन में है, या फिर हमारा इन्वायरमेंट ही ऐसा हो। तो उन्होंने कोई गलती कर दी, तो उनका मास्टर बड़ा स्ट्रिक्ट था, तो कुछ भी अगर वो गलती करते तो मारता था सर। तो जब मैं उस हॉस्टल में गया, मैंने देखा तो उन्होंने बच्चों ने किया था, तो मैंने कहा आज चेंज कर लो आप। सबको एक एक को बुलाया, प्यार से समझाया क्या बात हुई, क्यों गलती हुई। तो मतलब वो अनकंफर्ट हो गए मैडम। वो उनको यही ध्यान में था कि आज मार खाना है और फिर सोना है, क्यों। मतलब उन्होंने एक हैबिट बना ली थी, एक टेंडेंसी होती है ना मैडम। तो मास्टर को समझाया कि नहीं, इनको थोड़ा हमेशा आप है ना, मतलब ये बांटने का तरीका गलत है आपका।
बिल्कुल,
उन्होंने ये
हमेशा डांटना काम नहीं करता।
हाँ, वो फिर बच्चों ने कहा कि भैया, मतलब रोने लग गए बच्चे, क्या मतलब प्यार से भी समझाया जा सकता है, मतलब इस चीज को उनको पता ही नहीं था कि इसको प्यार से भी समझाया जा सकता है। तो वो हमेशा मतलब वो ना तो फिर उससे बात जोड़ते थे, ना फीलिंग शेयर करते, तो आपस में ही रहते थे। और वो मतलब मैंने फील किया कि वो एक अलग ही थोड़ी दुनिया उन्होंने बना ली थी अपनी, क्योंकि हॉस्टल में रहने से वो दुनिया से भी दूर थे, और आदिवासी क्षेत्र से उनको होने की वजह से उनको कुछ नॉलेज नहीं था मैडम, मतलब बाहर का एनवायरनमेंट का। और इसलिए वो जो कहता था वही उन्होंने मान लिया कि हाँ ये करेंगे तो ये मार पड़ेगी और ऐसे जाना होगा। ये चीज जो मैंने फील की थी। थैंक यू मैम।
ओके, वेरी गुड, दैट्स गुड, आपने इस तरह के स्टूडेंट्स को हेल्प किया। सो दर्श हैज रिटन, poor diet due to work, noise pollution, excess of caffeine intake can be environmental factors. Yes, when you are having excessive caffeine can trigger the brain parts which can make you feel excited for a very short duration of time, but after that you have sudden drop in your energy which can contribute in feeling depressed and feeling low for a very long time. So there are some people who get addicted to the high of caffeine, noise pollution, poor diet. So yes, poor diet also contributes. There are so many factors. So I want to tell you some of the factors. Okay, drug and alcohol abuse, overwork, poor diet, lack of exercise, poor sleep, and some of the environmental factors such as natural disasters and electrical pollution, because radio waves generated by the electrical equipments can, can promote depression and rage. So there are so many environmental pollutants in depression, substance abuse, There are so many things which can contribute into building up of your depression. These things alone are not very strong, but if a person has a bad lifestyle, so it can trigger the genetic factors. It is very similar to a person who might be having एक किसी के पर्सन की जेनेटिक हिस्ट्री में बहुत पहले किसी को हुआ होगा कुछ कोई डिजीज, बट इतने टाइम तक वो रिसरफेस ही नहीं हुआ. बट इफ यू गेट अ वेरी पुअर एनवायरमेंटल फैक्टर्स, योर जेनेटिक फैक्टर्स कैन गेट ट्रिगर एंड यू कैन एक्सपीरियंस depression and any kind of illness which you might be having some genetical predisposition. So let's talk about the symptoms once again. Okay, so depression symptoms can vary from mild to severe, and which can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increasing purposeless physical activity. Purposeless physical activity का मतलब कि inability to sit still, pacing, hand wringing, unnecessary movement, or very slow movements or speech. So these things are so that it is very difficult to identify for some people. Feeling worthless, guilty, difficulty concentrating and making decision, thoughts of death and suicide. Depression and suicidal ideation are commonly related. So in order to be diagnosed for depression, these symptoms must last at least 2 weeks, 2 week तक रहने चाहिए, and must represent a change in your previous level of functioning and for diagnosis of depression. So other than that, there are certain medical conditions also, such as thyroid problem, vitamin deficiency, can mimic symptoms of depression. So whenever a psychiatrist, a person or any counselor, even counselor and psychiatrist and clinical psychologist meet a person who is experiencing these symptoms, उनसे पूछा जाता है कि आपकी जनरल हेल्थ तो सही है क्या, do you have any thyroid problems, do you have any hormonal imbalance, do you have any vitamin deficiency, because उनकी deficiency जो हमारी body में response आता है, it can mimic the symptoms of depression. So whenever a person goes to them, so in case of females, it is always asked, are your hormones are in place, are your menstrual cycle, is your menstrual cycle all fine, do you have any deficiency, iron deficiency. So these are some of the contributing factors. Okay, so we spoke about depression, how depression is different from sadness and grief, because being sad is not same as having depression, and grieving process is natural and unique to each individual and share some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. So grief का मतलब समझते हैं आप? ये terms sometimes, these terms can sometimes be used parallelly. Okay, Priyanka. Hello, am I audible? No one is responding.
Yes, ma'am. Yes.
Grief का मतलब समझते हैं?
No, madam.
Grief का मतलब होता है कि okay, grief का मतलब, grief means whenever anything bad happens and you are grieving the process. Grieving मतलब आप उसको, you are शोक व्यक्त कर रहे हैं आप.
Okay.
You are mourning.
Okay.
Okay.
Sympathy.
Not sympathy, mourning. जैसे कि death हो जाती है, if anyone has a loved one is dead, then you are mourning. आपका बहुत दिनों तक मूड ठीक नहीं रहता. Mourning. आप शोक मना रहे हैं उसी चीज का. So
okay.
है ना, grief it's a very different thing from sadness. Sometimes it can look very similar कि बहुत दिन से very commonly people use कि मुझे तो depression हो रहा है. But clinical depression is very different from the natural sadness we all feel and grief. Grief is a natural response. कुछ बुरा होगा तो painful feelings आएंगी. So, right. So in grief, painful feelings come in waves, often intermixed with positive memories of the deceased. But in major depression, mood and interest are decreased for more than 2 weeks. So grief can be a combination of positive and some painful feelings which come in wave. But in the major depression, mood is constantly low and there is lack of interest in all the activities for at least more than 2 weeks. उठा नहीं जा रहा है सुबह, नींद नहीं आ रही है, खाना नहीं खाया जा रहा है. You know, once upon a time, one of my client who came, she had a breakup and whole day she used to keep crying and बेचारी रो के सो जाती थी. She used to forget खाना कब खाया है, पानी कब पिया है. उसकी वजह से उसका बीपी लो हो गया था. She was hospitalized and sometimes she was grieving the entire process so much for a very long time that she was diagnosed for depression. And the whole episode of all these emotions, grieving a loss of a loved one, grieving a romantic partner. So it was so intense for her that her memory actively erased all those from her mind. It was so overwhelming for her that her brain actively erased. So after she got over with depression, she started feeling good. She could not remember those 2 to 3 months, which was so overwhelming for her nervous system. So grief and depression can coexist because when we are experiencing depression, grief could be very first thing, such as especially in the case of death, sudden death, or losing a job, being a victim of physical assault, or a major disaster can lead to depression. Do you know, last year एक study हुई थी. Are you aware about the Kedarnath floods which happened in 2013?
Yes, ma'am. Yes, ma'am.
It
So
was
many Gujaratis are there. Yeah.
And NIMHANS, I think NIMHANS did a study on the people who were living there and who have lost and who went there for pilgrimage. So there are so many people who are still traumatized by whatever happened in those few days. Because it was a major disaster, everyone lost everything. Suddenly, it was inevitable. So grieve, they did grieve, but there are some people who totally lost their senses.
मैडम इसमें केदारनाथ का जो मैडम जो थे उसमें एक पेरेंट्स एक मिले थे मुझसे, बुजुर्ग थे. उन्होंने बताया था कि उनको जो आवाज आई थी ना मैडम, अभी जब वो इवन जो वॉशरूम जाते हैं मैडम, उसको ऑन करते हैं ना, तो उसकी आवाज से भी उनको बहुत सी बार डर लग जाता है.
बिल्कुल बिल्कुल. इट वाज सो ट्रॉमेटाइजिंग.
ये चीज उन्होंने पर्सनली मतलब बताई, तो मुझे अभी भी याद आ गया आपने जैसे केदारनाथ का नाम लिया मैडम. वो बताते कि जब हम फ्लश करने जाते हैं ना, तो एकदम हम डर जाते हैं, क्योंकि उसका वाटर का आवाज, उसका लगभग सिमिलरिटी कुछ होती होगी उनको.
It reminds, it becomes a physical cue for the thing which they experienced. It becomes a cue.
Because every day वो होता है ना, तो थोड़ा थोड़ा बताते हैं कि हमें हल्का सा वो रोज याद आ जाता, मतलब
ये रोज बिल्कुल. तो वो जो छोटे छोटे cues है ना, they are triggering those memory of that traumatic experience. So what, even if it has been 2022 हो गया, it is 9 years, but still they are experiencing all that in chunks. Whenever there is some physical cue, where is audio cue, whenever they talk about, they are still sometimes experiencing. Many people experienced and are still being treated for depression. Many people had PTSD after that incident, because that entire thing was so traumatic for them. Okay, let's talk about risk factor. So there are three things. We spoke biochemistry. So sometimes, so all these situations, there were some triggers. There are sometimes the environmental factors. Ki parents mein ladai ho rahi hai, our parents are then constantly fighting, and there is some physical abuse. You experience bullied. So sometimes there are some apparent triggers, but it is also a possibility that there are not any trigger. You cannot identify a trigger. If you ask that person to fill that depression inventory or any depression scale, you would identify that you cannot see that koi apparent koi trigger hai. And even if you ask them, you take their case history कि 6 months पहले कुछ हुआ था क्या, और अगर आप और पीछे गए 1 year पहले कुछ हुआ था, 2 years पहले कुछ हुआ था which was very impactful for you, you may not be able to identify any strong trigger. So in that case, biochemistry is playing a very strong role. So sometimes differences in certain chemicals in the brain may contribute to the symptoms of depression. So that the changes in biochemistry and the neurotransmitters, it can impact so much that a person feels out of place and depressed. And yes, if it is left untreated, it shows in different aspect of their body, their physical appearance, and also the way they feel about themselves in their social gathering, social settings. Genetic factors we spoke about, it can run in family. अगर one identical twin को है तो 7 दूसरे identical twin को depression होने के 70% chances हैं at some point of time. Personality, people with self-esteem, who are easily overwhelmed by stress, who are genetically pessimistic to appear to be more likely to experience depression. Okay. So आपने personality कभी पढ़ा है? Types of personality? Have you ever studied personality types?
Yeah.
Type A, type B.
Yes, ma'am.
कुछ याद है? कौन सी?
हाँ मैम, एक पर्सनालिटी है जो कभी भी रेस्ट नहीं कर पाते हैं, हर टाइम कोई ना कोई काम के बारे में, कोई ना कोई प्लानिंग के बारे में, कोई ना कोई गोल अचीव करने के बारे में सोचते हैं. एवरी टाइम रेस्टलेस टू अचीव देयर गोल. एंड आई फॉरगॉट मैम व्हिच टाइप ए पर्सनालिटी और टाइप बी. टाइप ए शायद, आई फॉरगॉट मैम. And they always very tense to reach to their goal. They think their time is very short and their workload is huge.
Right.
Yes, ma'am.
So I think type A personality has more chances to experience depression because they are workaholics, and they are more likely to, because they are constantly working, they're constantly striving for. I'm not confirmed, so मैं अभी कुछ comment नहीं करूँगी. As far as I remember, it is type A who is more prone to experiencing anxiety and depression in their life because their personality is so that they can get overwhelmed by stress. Okay. Environmental factors: exposure to violence, neglect, abuse, poverty, and natural disasters. The family type can make people more vulnerable to depression. How is depression treated? All of us know depression is treatable, and most between 80 to 90% of people with depression respond well to the treatment. And अगर बहुत बिगड़ा हुआ depression भी है, such as 20 years, 25 years, 30 years, say, if anyone is experiencing depression, even in those cases, they can experience some relief. Darsh, it's type A. Okay. So they can gain some relief from their symptoms. So it is after a diagnosis and the treatment, and the mental status examination is done, the entire case history is taken, and after that the entire diagnosis is done. generally medication helps along with therapy, because the brain chemistry contributes how the person depression is intensified. So various degrees of antidepressant might be prescribed to help modify one's brain chemistry. Okay, I want to talk to you about a person's when a person is responsive and when a person is reactive. I think I have पहले भी किसी lesson में बात की है regarding a person being responsive or being reactive. So when a person is reactive, which is their brain chemistry is causing them to be reactive, they're just responding to the stimulus the brain chemicals are making. Okay, so whenever these brain chemicals, there is some changes in their neurochemistry and brain chemistry, it is very difficult for them to absorb whatever you are saying in a counseling session. तो आप काउंसलिंग सेशन में उनको आप बताओगे इन साइकोथेरेपी एंड टॉक थेरेपी कि प्रॉब्लम सॉल्विंग के लिए ये करिए, ट्राई दिस मेडिटेशन, ट्राई दैट, आप इतने दिन से घर में बैठे हैं, यू शुड go out, you should move more, you should try exercise, that person would feel like giving you a nice slap, because that person's brain chemistry is annoying that person so much that it is very, for a person जिसके लिए सुबह उठना, उठ के पानी पीना can feel like a very big task. How can that person go and go for a walk? Because going for a walk can include 10 steps, getting up, washing your face, wearing some comfortable clothes, putting on shoes, making sure that you are leaving. If in case you have to lock your house, making sure that the key is in place, you're not losing the key. So even the thought of doing all those steps can make that person nahi karna mujhko. So when a person, you can clearly identify उस person के लिए basic चीजें करना भी बहुत मुश्किल हो रहा है. So it is always advised कि you refer them to a psychiatrist so that antidepressant might be prescribed to them. So and you also would identify there are some people उनके लिए काउंसलिंग के लिए आना ही बहुत मुश्किल होता है. Forget about referring to a psychiatrist. They would say कि वो medications दे देंगे, sedatives होती है या फिर habit लग जाती है. So
yes, you're right.
है ना, वो बोलेंगे हैबिट लग जाएगी, इस मतलब हम पागल ही हो चुके हैं क्या कि मेडिकेशन खाएं हम. सो वही है. सो समटाइम्स the medication help after taking medication for a few months. Then when you introduce psychotherapy, the person would be more responsive to it. So you have to break the taboo of the person ki nahi, medications are not bad. Always a psychiatrist provides medication from a very small dosage, and if the person is able to take that, if the person is responsive to the medical treatment, only after it is increased. They do not give very high dose of medication very early, and medication only help you feel better over a few time. And a combination of medication and psychotherapy is always it works best when the levels of depression are moderate to high, because when they are moderate to high, depression काफी severe हो सकता है, and there are chances that depression is impacting the life of a person to a very large level, and it is causing disturbance in many aspects of their life, that they're not able to, they are taking leaves from their job, they're not able to concentrate, their social and personal relationship with their family and friends are getting impacted, their relationship with themselves are getting impacted, they do not feel like themselves. So medication helps them having a relatively stable brain chemistry, so that when they come into a counseling session, in a therapy session, they are responsive, they are absorbing whatever you are saying. Because you know, there are some people who are depressed, they do not talk. So if you ask them to talk, they would get exhausted. So in some cases, it is good to have some medication. So after having some medication, the people experience some improvement. पहले few weeks से improvement feel होने लग जाता है, and then उसके बाद में parallelly psychotherapy can be introduced. So psychotherapy or talk therapy sometimes used alone for the treatment of mild depression, as I said. And for moderate and severe depression, psychotherapy is often used along with antidepressant medication. So in psychotherapy, depending on how that person is experiencing depression. So I want to also talk about, whenever you have a case, every case of depression would be unique. Sometimes it is coming from a negative self-belief, and sometimes it is coming from the emotional part of that person. So different psychotherapies can be helpful. So please wait. I want to share the psychotherapy. Can you see my screen?
Yeah, ma'am.
So when I was talking about there are different ways to treat depression in psychotherapy as well, there are so many psychotherapies which are there. So on the basis of where that depression is coming from. So whenever you would be taking the case history, you would be identifying कि इस person के कुछ unhelpful thinking patterns हैं. Okay, so the unhelpful thinking patterns कि मेरे साथ तो कुछ हो ही नहीं सकता, that jumping to conclusions, all or nothing thinking कि मैंने पहली बार एग्जाम दिया था, जैसे कि there are some students, they appear for net examination for the very first time and they find it really difficult, and after that they never want to appear for it again, that एक बार खराब हो गया अब तो कभी मेरा होगा ही नहीं. So it is all or nothing thinking, या तो मेरा होगा या तो मुझे कभी देना ही नहीं है. Jumping to conclusion, making conclusions out of very less data. Labeling कि हाँ मुझसे ये हुआ ही नहीं, I am stupid. Whenever I get on stage, I always fumble, I can never speak. Labeling themselves, disqualifying the positive. Even if the situation has a mixed set of responses, mixed set of events, but you are disqualifying the positive कि कुछ अच्छा भी हुआ होगा उसको भूल जाएंगे, सिर्फ नेगेटिव की तरफ ध्यान जाएगा. But everybody was laughing, but the front row वाली teachers were yawning at me, my friends were making faces, nobody was listening. जिस समय the moment I was speaking on the stage, उसी समय पे the sound system went bad. So you are disqualifying the positive, that you, even if you were speaking, there were people who were responding, there were people who were nodding to it, there were people who were taking interest, but rather than the positive things, you are disqualifying the positive, but you are thinking of all the negative things which happened. So these are some of the distorted thinking patterns which are also known as cognitive distortions. So you should be knowing kahan se aa raha hai depression, the talk should and must ki if I was topper till class 12th, I should always be topper and I must crack this exam in first go, I must always look better, I cannot falter. So these cognitions and these thinking patterns around should and must can contribute in thinking. So it never gives you a room for trying. Having a mental filter, emotional reasoning, overgeneralizing. These I would give you a list of cognitive distortion. We are running a little low on time, so I won't get into much detail. So I would give you the entire thing. Okay, overcoming unhelpful thinking styles, identifying them, then challenging them, rewriting them, be mindful, distract. So agar cognitive distortion is something which is causing to your depression, that if I appeared for this exam and I could not make up to a certain cutoff, then I am not able to, I will never be able to do it. Then you have to identify that that person has a all or none thinking कि अभी या तो होगा या कभी कभी होगा ही नहीं, तो आइडेंटिफाई करो, देन चैलेंज इट, क्यों नहीं होगा, नेक्स्ट टाइम ट्राई करेंगे तो क्यों नहीं होगा, दिस एग्जाम इज नॉट क्रैकेबल, ऐसा तो नहीं है कि क्रैक नहीं हो सकता. देयर आर पीपल, गिव रेफरेंसेस कि देयर आर पीपल हु वर नॉट वेरी इंटेलिजेंट in the terms of their academic record, but still after persistent and having a good academic style and the learning style and routine, they were able to crack this exam. Rewriting it, reminding it. So rewriting means giving your brain the triggers again and again that yes, I can do it. Come up with more realistic and helpful, healthy and balancing thought that I can do it irrespective. Pehle nahi hua to kya? Rewrite that yes, I can do that. I can crack this exam. I am studying well for this exam. I'm completing the task on time. So, and then being mindful whenever you have a negative thought and a judgment about yourself, be mindful and allow it to pass. Distract yourself with the help of some drawing, painting, musical exercises, anything which can helps you distract with the thing.
Ma'am,
A healthy lifestyle. Yeah.
may I ask one question, ma'am?
Please.
Ma'am, I heard about the EFT, emotional freedom technique. Is it helpful, ma'am?
Yes, I was coming to that only because generally cognitive CBT is what being promoted for depression. So when, okay.
Ma'am, CBT, not CBT, but EFT, emotional freedom technique.
EFT.
Yes, ma'am.
So EFT is very helpful when a person is having emotional response. Okay.
Okay, ma'am.
Emotional freedom technique. Okay, it is an evidence-based self-help therapeutic method, and it is helpful in identifying and breaking down the emotions by talking about it. So there are, so I spoke about jahan pe cognitive distortions and unhelpful thinking patterns की वजह से depression में contribution हो रहा है. So वहाँ पे EFT काम नहीं करेगी, but जहाँ पे उस person का pattern is more on the emotional level, वहाँ पे emotional freedom technique helps both cognitive and somatic elements. So यहाँ पे EFT is intervention which combines the elements of exposure, cognitive therapy, somatic stimulation. There are so many things which are done together to help that person feel better.
Okay,
so
ma'am, thank you.
EFT can be helpful in depression and anxiety because it is targeting that emotional response. It is also helpful in anxiety because the tapping method helps in anxiety. So there is one more therapy, REBT, rational emotive behavior therapy, which is helpful whenever a person has an emotional response. So when a person has overwhelming emotional response, rational emotive behavior therapy, I don't have it in PPD, but briefly if we talk about it, REBT, okay, REBT talks about rational emotive behavior therapy, and वहाँ पे rationalize किया जाता है हमारे emotions को, हम ऐसा क्यों feel कर रहे हैं. So by rationalizing, we are challenging it, and then we are adopting rational emotions as a part of our new, जैसे वहाँ पे cognitive framework को we were challenging, यहाँ पे हम लोग unhelpful emotional responses को challenge करते हैं and rational emotional responses को adopt करते हैं. Okay. Okay, wait. So I think this is all about depression. Do you have any questions?
मैम ये रेशनल एक्सप्लेन करेंगे मैम?
REBT. Wait a second.
या
I'm you waiting a picture. Okay.
हेलो
Wait. मैं पिक्चर देख रही हूँ, राइट पिक्चर, मैं डायग्राम बना नहीं पाऊंगी. ओहो, पिंटरेस्ट पर आ रहा है.
हेलो
ओके अभिषेक, डायग्राम तो नहीं मिला मुझे, बट मुझे कुछ मिल गया है. कैन ओके. सो REBT कोग्निटिव बिहेवियर थेरेपी के ऊपर ही बेस्ड है, बट REBT स्पेसिफिकली टॉक्स अबाउट हाउ टू आइडेंटिफाई. Okay, so the core can you see my screen?
या मैम
Okay, so the core concept of REBT is ABC model. ABC model explains why we blame external events for our happiness. It is our interpretation of these events that truly lies at the heart of psychological distress. And ABC का acronym है activating event, which is something happens in the environment around you. B, belief, which describes your thought about the event or situation, and C is the consequence. A means activating event, B is belief, C is consequence. So on the basis of that, यहाँ पे ABC मॉडल को लगाते हैं, ओके, REBT के अंदर. So यहाँ पे we have to identify the underlying beliefs which lead to this psychological distress. यहाँ पे सिर्फ सारा फोकस है कि how you are feeling the emotion. So you are feeling excessively upset over other people mistake or misconduct, believing that you must be perfectly competent, believing that you would be happier, feelings that you have no control over your happiness, the entire, okay. So the important part of REBT process is learning how to replace your irrational beliefs and healthier ones, and the process can be daunting. So यहाँ पे the entire idea is to help people respond rationally to the situations that would typically cause stress, depression, and negative feelings. So यहाँ पे हमारा whole idea of REBT that you have to teach our clients that you are worthy of self-acceptance. So whatever they are feeling it, whatever their emotions are telling them, so उस emotions को कैसे interpret कर रहे हैं, उनको उसको break down करना सिखाते हैं. We teach them how to break down how they're interpreting their life events, such as that I am unworthy because I did not appear well for that exam, I failed in that relationship, I'm never going to have that relationship, and uski wajah se the kind of emotions they are feeling, and they are feeling feeling shame and guilt, they are never going to try for a healthy relationship again. And so to have acceptance of the entire situation, that even if the entire situation broke down and had some trauma associated with it, and you faltered at some point of time, so you are worthy of acceptance even if you did some behaviors which you do not like. And also acceptance of the certain things, that negative things will happen in life does not mean that things are happening in a way they shouldn't be. हमेशा बुरी चीजें ही नहीं होती. So whenever this happens a lot with people जिनकी life में बहुत struggle रहा होता है, so वो हमेशा उनकी negative thinking ही बन जाती है. They are never open to having positive experiences. Due to that, they are always picking up negative experiences. कुछ अच्छा भी होगा तो they would not identify it. So वहाँ पे REBT helps them to break down to how to interpret their life events in a way which is not at all, not 100% negative, because not everything is 100% negative. Even if you had faced any trauma, 2020 was very traumatic for all of us, for the entire world, because this was something new all of us experienced. The COVID, the trauma related to COVID, being isolated, the lockdown, being limited to there are some people who lost their jobs. In the second wave, there are people who lost their family members, lost their loved ones. They did not even had any closure to even see them. So all these things can leave so much trauma in you, which can break down the way you see your life. So if you have lost, you are consistently and frequently facing disappointments in your life, उस person का belief system ही change हो जाता है कि मेरे साथ तो कभी कुछ अच्छा हो ही नहीं सकता. I can never experience good moments in my life. Everything good which I have achieved and I had always goes away. I always lose the good people in my life. So they are not even open to the good experiences in their life. So यहाँ पे REBT उनका जो interpretation है वो थोड़ा सा change करता है to help them identify, to have a holistic picture of the entire experience. So this helps them. तो उसके benefits होते हैं. हाँ, so it helps people manage their emotions, cognitions and behaviors. So sport psychology में बड़ा helpful होता है irrational belief and anxiety reduce करने में, reduce feeling of anger, anxiety and depression, improved health and quality. So it is very effective जहाँ पे emotional responses are very strong and the way people are attributing to it. So this was the entire. There are some more techniques, transactional analysis. So in the upcoming sessions, Shreyashi ma'am would be taking all the psychotherapies, if I'm not wrong. So you would learn more about every psychotherapy and how to get into therapies and what are the few models and how you can identify how each model works like, and at the end of the day you can see which model suits you, or if you want to have a eclectic approach. So okay, one more thing I want to ask you all, आपने सबने MSc खोल के देख लिया था क्या? I had shared mental status examination. Do you want me to go over it again?
No, ma'am, actually. We are absent in Sunday.
So MSc is not very complicated. The form I had shared with you, it would help you, and MSc is not supposed to be done in very detail. It should be done in 5 to 10 minutes. And most of it is how you are observing that person. So it should not take more than 5 to 10 minutes because you have different screening tests as well to perform. So MSc ke parameters, what kind of how to identify, that document is very well explaining how to identify the posture, the eye contact, the level of orientation. So वो MSc इतना complicated नहीं है. So okay, I'll take 2 minutes of break, but before that, everyone please write down what all kinds of assessments and screening tool you know. आपको कौन से assessments या screening tools मालूम है whenever we are doing any mental health assessment and screening? So आपको जो मालूम है, जिसका नाम सुना है, जो कभी use किया है, please write in the comment box, because we would be doing 4 to 5 screening assessment in today's class. So I'm taking a break of 3 minutes precisely.
Ma'am, is the class is over?
No, class is not over. We would be talking about screening just give me 2 minutes.
Okay, ma'am.
Are you able to see my screen?
Yes, ma'am.
So I'm seeing your chats. Okay. So many tests do you know? DAS. Abhishek, one blank paper pen. What is this? DAI, DASP. Darsh has written 16 PF, TAT, Rorschach, Wechsler's, adult assessment test, DAP. Wow, you know so many tests. Great. So in the last class, we discussed anxiety. So this is Beck anxiety inventory. So, okay. So all these tests which you are telling, some of them are very detailed tests and some of the tests are very screening tests. So what is the difference between a screening test and a more profound or more detailed test? Screening tests are used in the first previous sessions where you are trying to identify the severity of the symptoms which are being faced by or experienced by your client. So the purpose of screening कि आपको मालूम नहीं है कि what is the level of symptoms or if a person is experiencing any special type of symptoms or not. It is similar to any kind of screening exams, any kind of prelim exam which happens, right? Prelim exam का purpose क्या होता है? These are screening exams to identify who are the people who are performing good or who are performing poor. So in order to filter out what is the extent of people's performance on different subtypes or subtests or sub-examination. So the screening test is done. So the same purpose screening tests which are done in mental health or any counseling sessions are to identify what the severity of the symptoms. यहाँ पे we cannot diagnose a person, but we are trying to identify कि उसको severity of the symptoms क्या है. Screening, so this is the first purpose of having a screening test, to identify the severity of the symptoms or to understand how that person, how our client is experiencing those symptoms. You would always find some of the clients which would explain very weird symptoms कि मुझे अजीब सा लग रहा है, या फिर sometimes they do not have the right words. कि मुझे खुजली हो रही है, मुझे ऐसा सा लग रहा है, मुझे ऐसा सा लग रहा है, पता नहीं मेरा मन अजीब सा हो रहा है. So sometimes they give very vague explanation of how they are feeling because they do not know how to explain what they are feeling, what they are experiencing. So these screening tests help us identify especially what they are feeling and to what level, and secondly to rule out all other different conditions. So this is Beck Anxiety Inventory. This scale is a self-report measure of anxiety. It has 21 items. It has internal consistency, Cronbeck alpha 0.92 and test reliability of 0.75. So it is a valid and reliable scale. And its scoring and its response type are, it is a Likert scale. 0 means not at all, 1 means mildly, but it did not bother me much. Moderately, it wasn't pleasant at times. Severely, it bothered me a lot. And how to identify the total?
Ma'am, will we get this PDF format?
You will get it because there after today's assignment there is another assignment regarding the test you would be getting. You would get all these, don't worry.
Okay, ma'am.
Okay, so how to calculate the total score? You have to calculate the total score finding the sum of 21 items. And how to interpret the score? The score of 0 to 21 means low anxiety, 22 to 35 means moderate anxiety, a score of 36 and above potentially concerning levels of anxiety. So what we had discussed in the last lecture and today's lecture as well, that a relatively low to moderate anxiety, we can work in the sessions, and when the anxiety levels are too high, then a help of a medical professional can be taken. So let's see how does the back anxiety inventory looks like. So if you see, it is a list of common symptoms of anxiety. So the thing what I was saying, that sometimes they are not able to say कि how they are feeling, कि ऐसा ऐसा सा लग रहा है, पाँव में अजीब सा लग रहा है, फिंगर्स में अजीब सा लग रहा है, पता नहीं आजकल गर्मी क्यों लगती रहती है. So because they are not professionals, they do not know how to explain their symptoms. This is why screening tests come to our rescue to help them identify. So when they have a list of symptoms, then they can tick mark and express the severity how they are experiencing. So it has 21 items. So all the 21 items are the list of common symptoms of anxiety as experienced by people. So you can see numbness or tingling, feeling hot, wobbliness in legs, and being unable to relax, fear of worst happening, dizzy, lightheadedness, heart pounding, unsteady, terrified or afraid, nervous, feeling of choking, hands trembling, shaky, unsteady, feeling of losing control, difficulty in breathing, fear of dying, feeling scared, indigestion, faint, lightheadedness, face flushed, hot and cold sweat. So if you see, all the things, all the symptoms which are here have also the behavioral symptoms and also the physical symptoms. So everyone can, all of you identify which one is the behavioral symptom, and one behavioral symptom and one physical symptom. The test is in front of you. If you want to ask me to scroll down, I'll scroll down as well. Identify one behavioral symptom and one physical symptoms from the test which is being displayed in front of you. Who will go first?
Ma'am, unable to relax, it is behavioral. And terrified or afraid, this is a mental psychological symptom.
Okay. Next, who will go? Abhishek. Who will go next? I'm also looking at the chat box.
Madam, may I?
Yes, please. Oops, sorry.
Madam, physical, it is not here showing.
Sorry.
Yeah.
Now can you see?
Yeah, now I can see. Madam, feeling hot is a physical symptom. Okay. Unable to relax, it's a behavioral symptom. And one more thing, fear of losing control is a psychological symptom.
Right.
Fear of dying is a psychological symptom.
Okay.
Is
Very
a psychological symptom. But
Very good. Well
indigestion is a physical symptom.
It is a physical
Indigestion is a
symptom.
physical symptom.
It is a physical symptom. Yes, yes. Well identified.
Yeah.
Next.
Next. May I
Next.
cover all these or other?
No, you don't have to. You just have to give one each.
Okay. I have already covered. No, ma'am?
Yes, you have covered.
Okay.
Darsh is saying indigestion is physical. And Darsh, which is the behavioral symptoms? Do you want me to scroll down? I'll also scroll down. Abhishek, scared is behavioral and psychological symptoms. Abhishek, kahan gaya? Abhishek, are you even there? Abhishek, is he here? Nah, nahi hai yahan pe. Okay. So you can see that it is a mix of all the behavioral, psychological, and physical symptoms. Okay, this is how. So it is very easy to do, should not take much time. So whenever you are, so do you know the rules of test administration? How to do a proper test administration?
Madam, I don't know clearly because I am not from psychology background.
Okay, so this goes for all the test administration. Always tell that person that we are going to conduct a test. हमको उनको बताना नहीं है किस चीज के लिए कर रहे हैं कि एंजाइटी का है, डिप्रेशन का है, पर्सनालिटी डिसऑर्डर. We never tell them because that can they can give socially desirable answers. Okay. So we always tell them. So ये जो back anxiety inventory लिखा है, it is written, but whenever you are giving this to any person, and sometimes there are people who are not okay with being labeled कि हाँ मुझे anxiety हो गई, मेरे psychologist ने मुझे बता दिया that there is some anxiety, I am an anxious person, I have an anxiety disorder. So it is they cannot take the label. It is emotionally destroying for them. So generally this part where it is written back anxiety inventory is generally folded so that they cannot see what the test is about. It is generally said that in order to identify how you are feeling, we would be doing certain questionnaires, and you have to, you don't leave up to them to understand the instructions. You have to tell them the instruction that below is a list of common symptoms of anxiety, how you are feeling it. Please read carefully each item in the list, indicate how much you have been feeling. You have to read out entire set of instructions and tell them how to mark it. Not at all means 0, mildly means 1, moderately means 2, severely means 3. And you can only mark 1. Do not take too much time thinking on one statement. Okay, and if you are not able to get anything, you can ask. So yeah, so there are certain ways of doing any screening test. So it is always good to have a translated in case that person is not able to understand the language. But in case you do not have the translated one. Sometimes there are no translated test available in all the languages. So try not to explain everything, but dictionary meaning would be helpful, but it is not advised to translate. But yes, it is done in the practice. Okay, so this is Beck anxiety inventory. Now we will do Beck depression inventory. So the Beck depression inventory, it has 21 items and it is ranging from 0 to 3. The response type is same for the Beck depression inventory as well. So it is also about how the person is experiencing it and what is the range of their experience. Okay, so you can see I do not feel sad. I'm so sad and unhappy that I can stand it. You can identify. So here you can identify, is it normal sadness or it is sadness to a level that a person can stand it. So it is, so why did we discuss how to differentiate between normal sadness, which is experienced by everyone, and how clinical depression is different from it? All of us feel sad, all of us feel discouraged and failure and lose satisfaction, lose hope at some point of time. But it is, if it is very severe, it is intense feeling that one cannot stand out of it, and the person is scoring 2 to 3 on most of it, then you would see the scores would be elevated. So all these PDFs would be shared with you. We are a little short on time, so I would not be reading every statement here. So it has, as you can see, it has 21 items. 21 items are there, and interpreting the Beck depression inventory. So now you have completed the questionnaire. Add up the score for each of the 21 items by counting the number. So यहाँ पे वो circle करेंगे. They would circle anyone who is how to write report of test. Okay. I'll think we will have to take a separate class for that, because that is not exactly part of our syllabus. If you want, all of you, if you want to learn how to write a report, then we can arrange a separate class for it. But uske liye, you will have to do all these tests. We have a separate assignment for these assessments as well. So after a person has completed this circling every item, so that make sure that a person does not leave any item. Okay, so always after a person has completed it, आप check करोगे कि multiple entries तो नहीं की, जैसे कि कहीं पे 0 कर दिया, फिर 3 कर दिया, तो you will not, sometimes you would be confused कि उसमें से 0 mark किया या 3. So अगर किसी ने भर दिया, फॉर्म फिल कर दिया आपका, and उसके बाद में it is your duty to check first if a person has missed out on any item, responding on any item. Secondly, if there is any confusion regarding to the responses. And third, if a person has any doubt on certain items, what to understand, then try. और अगर वो confused भी हो रहा है person कि मुझे तो 1 भी लग रहा है, 2 भी लग रहा है, मैं कौन सा fill करूं, then you have to tell them whichever सबसे closely जिसके feel होता है. So there are people who do not sleep as well as they used to. They wake up 1 to 2 hours, या फिर वो अपने tiredness को identify नहीं कर पा रहे. So they are confused कि 1 भी नहीं है, 2 भी नहीं है. So how you are feeling, how you are experiencing these symptoms for the last 2 to 3 months. सबसे ज्यादा आजकल कैसा लग रहा है, जो वैसा भी होगा. ठीक है. So okay. The highest possible total score is 63. This would mean a person has circled all the number 3 and all the 21 questions. The lowest possible score is 0. So yes. Okay. So the total score, so there is no negative marking here. There is no reverse reverse question scoring is here. So जैसा जैसा fill किया है वैसा वैसा calculate करना है. यहाँ पे total score लिख देंगे. We would write down the total score here, and on the basis of total score, if it is 17, that a person has borderline clinical depression. 21 to 30, so the score range is there: 1 to 10, 11 to 16, 17 to 20, 21 to 30, 30 to 31 to 40, over 50. So you would be identify what is the level of depression. So this was Beck depression inventory. Okay, so sometimes people also,
this is very easy to apply, ma'am.
this is very easy to apply.
Yes,
So screening
yes,
test का purpose भी ये होता है कि वो elaborate नहीं होते as compared to the 16 PF, MBTI, TAT, Rorschach. वो तब किए जाते हैं. Those are applied when you want to dig deeper, because these are self-report. So there is a tendency of people to lie in these self-report inventories. So in that case, you can see a person is there is a social desirability. Social, do you understand what is social desirability? If I want to appear depressed, I will have to mark.
Communicate.
Sorry?
Want to communicate, ma'am.
No. Social desirability means, okay, if I am okay, let me give you an example. So while I was working in a railway hospital, so there was a provision for some people to get some holidays, given that they are mentally not feeling good. It was a provision, and it was a special provision that if you are feeling mental fatigue and you're not feeling good, then you can get certain holidays, given that your mental record can be checked, and it has been assessed and checked by a psychiatrist and a psychologist that yes, a person is significantly feeling bad, thus should be given certain holidays, or that person's work profile can be changed from being very difficult work profile to a slighter, easier one. So agar you can clearly see, if you have to fake depression, it is very easy to do so in self-report inventories, isn't it? अगर मुझे पता है मुझे डिप्रेशन फेक करने से छुट्टियां मिलेगी या मेरा काम आसान हो जाएगा, तो I would give responses which look like depression. I would act like I have depression. So I had a case in which a person was coming to a psychiatrist for at least 1.5 years, faking depression. He always used to come up show up in a ungroomed state, never used to respond, but he was not taking any medication. And he was pretending to be depressed for at least 1.5 years. And he was also showing socially desirable responses in his test. Okay. So if a person has to see, clearly dikh raha hai na, ki you could see in the statements, agar 0 karenge, that means low score aayega. That means depression nahi hai. But if I would take all the 3 in all the responses, that means I want to appear depressed. This is also a possibility that a person is actually feeling depressed, but sub areas mein to nahi hoga na. There would be some areas where a person is relatively relaxed. Okay, so this is DASS 21. This means depression, anxiety, stress scale. 21 means the 21 items it has. You have to write down the name and the date. Generally, age is also written. So the instructions, please read each statement, circle a number, from 1 to 3 to indicate how much that statement applied to you over the past week. There are no right and wrong answers. Do not spend too much time on any statement. The explanation of rating scale is as follows. 0 means do not apply to me at all. 2, 3 apply to me very much and most of the time. Okay, there is one comment in the chat. Priyanka, okay. So yes, this is okay. So since it has 21 items which consist of all the 3 things, so this can also be used in as a screening, because it sometimes you are not able to identify if a person has a stress, anxiety, or depression, and you want to screen that person on all the 3 attributes. So this is the test which consists of items of stress, anxiety, and depression, all 3. So it has 21 items. So as you can see here, it is written SAD, ADS. So S means stress. So these items indicate stress. This item indicates anxiety. This item indicates depression. So these are shuffled. SAD, ADS, so you have to score them differently on all the three scales. So you can see it has all the statements. Now the scoring instructions is, so yes, it should not be used to replace a face-to-face clinical interview if you are experiencing significant emotional difficulty. So this is very basic. So screening interviews are supposed to be done in the very first few sessions when you're trying to identify how the person is feeling. So it is a set of 3 self-report scales designed to measure the emotional state of depression, anxiety, and stress. So if 21 is divided into 3, so 7 items divided into all the 3 subscales. So depression talks about all these things. It is okay. So one thing, on the basis of DASS, you cannot diagnose a person for a psychological disorder, because this DASS is done to identify the kind of mixed emotions a person is feeling. So on the basis of DASS, you cannot diagnose a person.
This means previous to answer we can cross check through DSS.
Yes, you can cross check.
Okay,
and the DASS was also done. It was also designed to be done on a group setting, so that 3 अलग-अलग stress scales use नहीं करने पड़े. But okay, so यहाँ पे so the scores of DASS 21 will be need to multiply by 2 to calculate the final score. For example, यहाँ पे 7 आ रहा है, तो 7 into 2 जो total score आएगा हर एक सब scale पे, you have to multiply it to 2 to calculate final score. Okay, and then on the basis of that you can identify the range: normal, mild, moderate, severe, extremely severe, and the level of depression, anxiety, and stress. So this was DASS. There is one more.
मैम ऑलरेडी 10 PM क्लास खत्म नहीं होगा आज.
ये मेरी लास्ट लेक्चर है, इसलिए आई एम ट्राइंग टू फिनिश इट.
ओके मैम, ओके.
बट यस, रिपोर्ट के ऊपर एक और है. इफ सर अलाउज मी, we can talk about report as well. So there is last one, which is state trait anxiety questionnaire. So there is one thing about anxiety is that I will share the PDF with you. I'm not showing it on the screen. So when people were studying anxiety and were making different scales of anxiety, they identified that understanding anxiety and how a person experiences anxiety is different. That means एक anxiety one type of anxiety which we feel is a state, and one anxiety is trait. Such as state means at a particular state, how you are feeling anxious. So it can be differentiated, a person who feels anxious in certain situations or a person who is anxious most of the times. दोनों में डिफरेंस हुआ ना? जैसे कि मुझे एंजाइटी तभी हो रही है जब मेरे सामने सर पढ़ा रहे हैं, और मुझे एक मेरी फ्रेंड है, उसको एंजाइटी हो रही है बिकॉज उसको हमेशा ही एंजाइटी रहती है. सो द स्टेट एंजाइटी मीन्स इट इज मोर जनरल. State anxiety is more temporary condition of anxiety, and trait anxiety was general and long standing quality, because a person has been anxious for so long that उसके person के लिए anxious रहना ही normal हो गया है, उसकी personality trait बन चुकी है being anxious. So this was STAI. And one last I want to share, because you आपके पास में emotional वाले भी आएंगे. I would share that in the Google Classroom. So there is a 3-dimensional scale attachment style. So if you talk to some people who have different ways of associating with people, different ways of interpreting it. So there is 3-item attachment style questionnaire, and it explains the kind of attachment style you have: anxious attachment style, avoidant attachment style, dismissive attachment style. So on the basis of your attachment style is how you behave in certain situations. So बहुत 3 items का ही है, बहुत easy सा है. So I would share all these with you. Okay, so I think some people have left. Shreyashi ma'am, so the assignment we wanted to give you, let's talk about the assignment. I'm not closing the live streaming yet because some people have left. So, okay, we would be talking about the assignment. Shreyashi ma'am, are you there?
Yes, I'm there.
Okay, so in the last class, we discussed different types of anxiety. And
Yes.
Those who have missed that class, please go through that class, because today on Google Classroom, we would be, since you have to do a case report and case study, 10 case report and 10 case studies. So you would be allotted every type, one type of anxiety disorder, and you have to do case study on the basis of that. So for Priyanka, it might be panic disorder. For Darsh, it might be phobias. So agar aapko phobia allot hota hai, then you have to make a case study. So wo jo 10 out of 10 case studies hai na, you would be doing one of it from anxiety. And similarly, you would also be you can do it on depression and other things, but since you missed last class, you are supposed to do this assignment. And so it would be the names and the allotted topic would be shared with you on Google Classroom, and the case report template would also be shared by you by Shreyashi ma'am in the Google Classroom. So please log into the Google Classroom and see how the assignment is given. And then if you have any queries regarding the assignment, please feel free to ask in the WhatsApp group as well. Shreyashi ma'am, do you have anything more to add?
No. You have covered all these things, and yeah, assignment, like we will give you some case report, and but you need to first log in the Google Classroom. Only Orpita Chatterjee joined, but others are not joined yet. So please join. Then I can share the format and the sample case history text.
And if you all the screening tests which are discussed today would also be shared in the Google Classroom. We won't be sharing them in the WhatsApp group. So please log in into the Google Classroom very soon so that you can see your material and your assignments and how to access the resources which we would be posting there, because you would require the PPTs and the PDFs. So we would be posting everything there only. It won't be shared in the WhatsApp group. So it is mandatory for everyone who is taking this course to join the Google Classroom. Okay, so I think today's class overshooted a little because we had to cover depression and screening. I'll ask sir if you want to know how to write report. So we would take a separate small class on how to write a report if all of you want to learn that. So on that note, we would conclude our today's class. If you have any questions, please feel free to drop in the WhatsApp group. If you have any queries, anything you want to ask, please have all the interactions in the WhatsApp group. Even if you are not able to attend your class, we want to know how you are doing and what is the reason, so that yes, it is a well-connected group. So on that note, please join Google Classroom by end of the day, because you would get only 1 week to complete the assignment. The sooner you enroll in the Google Classroom, the sooner you would see what is your allotted topic. Okay, shall we conclude our today's class? Any comments, any questions?
No, ma'am. Thank you.
Thank you everyone for staying for more than 2 hours and listening to me. Thank you so much. I hope this class have been helpful. And on that note, have a very good evening. Thank you everyone for joining. Now I'm closing this.
Yeah, ma'am, for giving us such a enriching thoughts about depression, screening, and anxiety. So looking more forward. Okay, thank you.
Thank you, ma'am.